Hello, everyone. Now is the top of the hour, so I'm just going to go ahead and get started on this amazing webinar. Before I get started, just wanted to say a big thank you to Vital Interactions and Jill Staley for being here today. My name is Camila Silva. I'm next Director of Innovation at NAC, and this type of webinar truly is only possible because of amazing partners. So we are very excited about today. And why are we here today? So really, as healthcare evolves, community health centers continually get faced with new challenges and opportunities. And embracing AI and patient-centered leadership has the power to transform efficiency and outcomes. The goal for today is going to be to equip health centers with the knowledge and tools needed to thrive while ensuring we preserve the mission of accessible and quality care. I know all of you in the room waiting patiently to hear from our amazing facilitators are already on their mission. You are taking that goal. So we are very excited to have today two amazing facilitators, Jill and Alan, to share their expertise in harnessing AI solutions and leadership strategies that maintain patient-centric values. So before I hand it over to our amazing facilitators, what to expect, today you're going to hear some practical insights and best practices tailored to your needs. We are going to have a Q&A at the end, so make sure throughout you are submitting your questions using the Q&A button in the bottom of your screen. We just ask that you do specify if the question is for Jill or Ellen or both, because that way we can better source the different things, the different questions to the different folks. So with that, I would love to turn it over to Jill and Alan, starting with Alan to introduce themselves and kickstart the webinar today. Thank you so much.
Awesome. Well, I'm Alan Stickler. I'm the Chief Technology Officer at Vital Interaction. I've spent over 20 years leading technology and innovation in healthcare to streamline operations, improve patient engagement, and drive better outcomes. I'm particularly passionate about harnessing AI to allow providers and staff to focus more on patient care and create hyper-personalization and patient experiences. At Vital Interaction, we're leveraging AI technology to communicate with over 5 million patients across 13,000 providers each year. We work closely with FQHCs and other healthcare organizations to reduce no-shows, increase visit volumes, close care gaps, all by automating outreach without adding staff burden. One of our key innovations is our Smart List engine, which leverages patient appointment, clinical, and billing data to create automated, customized outreach campaigns, helping FQHCs meet quality measures and closing care gaps and secure full funding. Jill?
Thanks, Alan. I hope you all can see my screen. I'm going to go ahead and get started. So if we haven't met yet, I'm Jill Steely, and I used to be the CEO of a federally qualified health center here in Helena, Montana for several years. I left there in 2023, and I now do coaching and business consulting for FQHC leaders and executives and staff full-time, because honestly, FQs are my passion. I just so strongly believe in the benefits that they bring to our communities. And you all are really the greatest people for working there. So I do offer a lot of different coaching programs based on the success that I had as a CEO at my health center, and was able to really bring that health center from nearly closing the doors to a thriving and profitable health center by offering exceptional patient care, really getting out into our communities and serving our patients the way that they wanted to be served. So I'm going to kick us off here and get started. Thank you all so much for joining us today. For showing up live, we actually have a couple of gifts for you. We have a great generational research study from Vital Interaction. This is goes across 4 different generations of 1,000 patients surveyed last summer, and really looks at how they like to interact with their providers based on, you know, what generation they are, because we all know different generations of people like to communicate in different ways. And then I have for you a patient journey map, and you will understand how to use this or how this applies to today's presentation. But really, it's a tool for you to go through the experience of your patient at your health center, so that you can really see if you are running a patient-centric health center, and that is really built into your culture. So stay till the end, and we will give you some QR codes for these great free gifts. All right, so let's go ahead and get started. Why is this so important? Well, it costs so much more to acquire a new patient than it is to retain one. So we're always wanting to look for ways to retain our patients, and the way that we can do that best is to provide them with really, really great care and customer service. The lifetime value of a patient can be between $5,500 and $8,200. Which generates, you know, a lot of revenue for your health center. A retained patient can generate 3 to 5 times more revenue compared to a new patient. So again, we really want to give them the best care so that they stay with our health centers. In addition, a satisfied patient is going to generate 3 to 5 patient referrals, and word of mouth referrals cost 90% less than traditional marketing. In addition, we see really good patient outcomes when we retain our patients, and that can result in 40% reduction in emergency room visits and a 25% decrease in hospitalization rates. So today we're going to talk about how you can transform your patient's experience at your health center. We really want to go from this transactional relationship to a transformational relationship with them, and how to create a patient-centric organizational culture. And then Alan's going to take us into how you can use AI to create a more personalized patient experience. So let's talk about how to go from transactional to transformational healthcare. We really want to look at how do we go beyond those clinical transactions or those clinical interactions. The evolution of the patient experience is really shifting from just showing up for their visit, seeing the provider, and leaving with a treatment plan. Patients are now, especially after the pandemic, looking for a holistic, human-centered approach for their care. And I think health centers have been patient-centered for a very long time, and probably the pioneers in that field. But there are some things that we can do to really make sure we are patient-centric across the organization, not just in the visit or with their visit in a day. So some of the ways that you can transform your healthcare is, first of all, it starts before they even come to their appointment. We want to address their fears, their anxieties, and emotional vulnerabilities that they're having and experiencing before they come in for an appointment, during the appointment, and even after the appointment. And we can do this through relationship management and communicating with them before, during, and after. We want to create environments that reduce stress and promote their emotional well-being. We want to use good technology, such as AI, like we're going to talk about today, to do some predictive health management. So using data from your electronic health record, wearable devices, your patient management systems, to identify patterns and trends and predict some of those future health risks. And then we always want to train our staff in cultural competencies, especially if we serve a large number of certain patient populations. We want to train them in active listening, trauma-informed care, and even hospitality, because that customer service element is really important. And then we want to teach patients things more than just their treatment plan or, how to become healthier through healthcare. It's really what's going on in their lives that we can teach them to have a better life. So skills such as grocery shopping, budgeting, financial risks, harm reduction, healthy habits, etc. Transformational care can reduce healthcare costs by up to 35%. So this is really important that we start looking at this. I have a couple of examples. So this is South Central Foundation. It's a community health center in Alaska. Shout out to them if they're on here today. But they've shifted from the transactional relationship to a more transformational relationship. They're doing comprehensive home-based primary care services and making sure they are having culturally competent teams by giving them a lot of training. This has reduced their emergency room visits for their patients by 50%. It's reduced their hospital administrations by 40%. I mean, you can see the results here. 55% reduction in health disparities for their Native American populations, and 42% increase in healthcare services for their underserved communities, which is really why we all exist in the first place. Now, the Mayo Clinic has also developed some comprehensive communication platforms to really transform their healthcare with their patients and the way they communicate with them. So they do this through text, phone, email, and even video with their patients. And beyond the telehealth, and I think we will see an example later of what that looks like. But they've implemented, empathy-driven staff trainings, which is so important. I always, in all of my leadership trainings, I talk about empathy and having an empathic staff. And then created a health patient-centered design in all of their physical facilities as well. So this has brought them some really great patient outcomes, a 40% reduction in treatment-related errors, 27% increase in patient engagement with their health management systems, and a 50% faster recovery times for those targeted interventions. And then we have Kaiser Permanente, which is a big health system in California. They have used AI to assist in their risk identification. They're running home-based monitoring programs and comprehensive wellness resources for their patients, such as gym discounts, personalized exercise plans, nutrition plans, things that will make someone overall much healthier, outside of that clinic interaction. This has also resulted in some really great patient outcomes, including a 35% decrease in avoidable hospitalizations for those chronic condition patients, and 1.5 billion saved through preventative medicine, and 28% reduction in per patient healthcare costs. It's also really, helped them be more culturally competent and reduce those disparities that we often see in healthcare. So a 36% reduction in racial healthcare access gaps, 31% increase in preventative care for minority populations, and a targeted program reduced health outcome disparities by 29%. So how do we go from transactional to transformational at our health centers? Well, it starts with emotional and psychological care for our patients, and then looking at their entire lives. And again, I think health centers have been really good about this. We're kind of industry leaders in looking at those social determinants of health and how they are affecting your patients' well-being and overall health care. But we can even go a little bit further with that and use some communication tactics and technology to address a lot of those social determinants as well. And then personalizing our communication with patients and really increasing how many touch points we have with patients over the lifespan of them using our health centers. So I would say it starts with anticipating your patient's needs. You could implement user-friendly websites and scheduling tools, so online scheduling. Make sure your website is ADA accessible and people can use them with their readers. and it's clear, and the pictures are labeled, and all of those things that help people who use readers navigate your website. Make it easy for them to schedule appointments, and then provide clear, empathetic, so acknowledging there's probably some fear there, there's probably some anxiety about it. Pre-appointment instructions and resources by mail, email, you can even do it via text, but making sure they're hearing from you far before the appointment. They should know what to expect when getting to your health center. They should be able to complete their documentation before they get there. That will help them feel much more comfortable. And then send those forms in advance and make them fillable online, because a lot of people don't have printers. They expect to be able to do things online. And you can even have a chat bot or AI on your website to assist them if they are running into any problems. You can reduce your friction with patients when you use culturally competent materials. So knowing what languages are primarily in your health center patient population, and having culturally competent materials for them, reduce their anxieties by letting them know what to expect, where to park, how to, get into the front door, which checkout to go to. And then even having some check-in kiosks will reduce that bottleneck that you experience at the front desk and have people check in online via a tablet or kiosk. I honestly don't have a provider now who doesn't have me check in on a tablet. Then we want to make sure that we're engaging with them. So we're developing that deeper, more empathetic approach to our patient interactions. And we do this through emotional intelligence. So we always want to keep training our staff in active listening, being empathetic to what the patient is going through, and recognizing their nonverbal cues of some, emotional distress that they might be in through this appointment process. Implement some trauma-informed care and psychological safety protocols for patient interactions. We can assume a lot of patients are coming in with emotional trauma, emotional stress, and so we need to just address that head on and be able to read from them, what's going on with them. Assess and screen patients for psychological barriers to healthcare. So a fear of a diagnosis, financial anxiety of paying for their appointment, and even mistrust in the healthcare system. And then implement ongoing sensitivity and cultural competency trainings. You can make your physical space very patient-centered as well. You can have a sensory-aware environment with natural lighting, acoustic engineering to reduce that noise and a comfortable temperature, because a lot of them are getting undressed. A spatial flow and navigation, so make sure they can find their way around your health center with clear-coded signs and wayfinding. Comfort zones, so multiple seat configurations in your waiting rooms and in the clinic rooms, free Wi-Fi, and even some charging outlets or spaces. And then really use technology to integrate, so real-time wait time information screens you could have, telehealth consultation pods, lots of ways to use technology without losing that human connection. Make sure your clinical rooms are patient-friendly and set up. You can use AI scribes now, or scribes, so the provider can be close to the patient and have some eye contact. I like to have technology integrators in the pods, because I think people get intimidated by our portals or by our softwares that we use to communicate with patients. So have someone come in and get them logged into it and show them how to use it. We all probably have seen the patient-centered care demonstration on the left. I also like the one on the right. We're really looking at the mission and vision of the patient. We are definitely including the patient in all of the treatment plans that we're creating, as well as their family. We're being very transparent and fast on getting them their labs, getting them a treatment plan follow-up, all the things. And then we want to have meaningful interactions that go beyond the patient visit and beyond those medical instructions. So you can design follow-up protocols that include tailored communication approaches for the patient. How do they like to have you communicate with them? Is it via text? Is it email? Is it a phone call? Create support mechanisms that extend beyond the clinic. So group check-ins, home visits are great for this, and help with that resource coordination and navigating other services for them. And then a health center tactic is writing prescriptions for those things identified in the social determinants of health, such as food, movement, housing, safe housing, and education. Patients love to listen to what their providers want them to do, so you can literally write prescriptions for them on those things. Use the patient's communication preferences to communicate regularly and consistently with them. And then celebrate with them. So it's not just, you're not always just I'm the healthcare provider and I just tell you about your healthcare, but I'm actually like recognizing and celebrating those achievements and milestones that you might be achieving. We're sending personalized congratulatory messages for health improvements that they accomplish. And all of these things can be done with, AI as well. It's not staff time that has to be doing this, and you can send personalized and tailored messages to your patients. And then continue the relationship building and you will retain your patients. So invite patients to fun events at the health center or educational events at the health center. Develop loyalty programs that offer genuine value and keep patients engaged. Develop easy mechanisms for patient feedback and continuous improvement, and then have referral and programs with incentives. There are lots of ways to get patient feedback these days. And I like to create a simple form where your staff can fill out a story about a patient. You can text patient surveys to them, limit it to 5 questions, so it's really easy. And you can utilize technology and companies that do this for you and will literally send you back patient feedback so you can use it in your marketing and on social media. Lastly, we want to create a patient-centric culture. We do this through technology integration, again, using that patient data to communicate regularly and consistently with patients. Invest in trainings to help staff how to understand the shift between transactional to transformational healthcare, and then create that patient experience team. So this is a cross-functional team that's looking at the patient's experience, and you can use that patient journey map that I'm going to give you to do this so they know where they need to improve. The patient, you can develop that multidimensional patient persona. So use that patient journey map, come up with those fake patient personas, and then literally map out what it is like for them to go through your health center. And then have a team that's constantly meeting and figuring out those ways to improve. Cultural transformation, these are just some tips. You can embed the patient experience into your organizational mission. So make sure this is something you're always working on, and regularly collect and act on patient feedback. Make sure you act on it, right? We don't want to just collect feedback. We want to do something about what we get. That staff training, again, really important. Develop in and invest in hospitality-focused training programs, empathetic communication, and patient care workshops, including doing some role play with your staff, ongoing patient experience audits, and education about the patient experience. So keep going through that journey of a patient to see what their experience is like, and then train your staff in trauma-informed care, cultural competencies, and assisting patients with disabilities. And lastly, that technology integration, which Alan's going to go into a lot more, but it's so important these days. It can save you a ton of money on staff time, but really retain patients through relationship management. So invest in a client relationship management or patient relationship management system. Use AI and machine learning systems for personalized patient communications. It doesn't have to sound like a robot. It doesn't have to be, just one text that goes out. It can be very personalized. And use user-friendly digital tools to communicate with and engage your patients, and implement those automated yet personalized follow-up systems. You can measure some things to make sure that this is working for you. Look at your patient retention rates, your referral rates, patient satisfaction scores, repeat visit percentages, and online review and ratings, and of course, your clinical outcomes.
So I think Jill spoke a lot about the transition from transactional to transformational and driving towards a patient-centric culture. So how can we do that when, at least from what I'm hearing, FQHCs are understaffed and already overworked? Obviously, Jill spoke about using technology, leveraging AI to do this. I thought maybe we'll step past some of the hype of AI and try to get into what it really is. How can we really use it today? And then a little bit about how we can move into it in the future as well. So what is AI and what is it not? So AI is a tool. AI, processes data, it identifies patterns, it makes predictions, and in many cases can automate tasks and enhance decision-making. AI is not replacing humans' judgment. It's not making decisions. It is helping people who are already doing this, and it makes us better. Oftentimes, I think of AI as an assistant, kind of making the things that we're good at better. It automates repetitive work using lots of context to do things that we don't want to do or don't have time to do as well as we want to. But AI can't connect to a person in a real way. It can't make judgment calls the way a person can. So these are some common applications of AI today. And this is an ever-changing world. We're moving faster than we ever have before, in my opinion. But these are real solutions and real capabilities of using AI today. So creating content. Jill talked about chatbots. There are virtual assistants. On my side of the world, where I build some of this technology, we use it for code generation, generating images, audio, data. So predictive analytics, creating insights and video. I talked about it already, but so there's a lot of things AI can do. I think another way of thinking about AI is this term of agents. It comes up a lot in my world. We see it all over the internet. On one end, we have what we would call app agents. So this is anything inside of an app you're already using, and you might see a lot of times they use that sort of diamond-looking icon for indicating that there is some AI here, some magic, if you will, but allowing you to use AI inside of the application, maybe in an EMR or a similar tool, even Word and Outlook these days, to summarize things or to clean things up. Those are all considered app agents. Workflow agents are taking over existing tasks that are pretty predictable and allowing them to be automated. And then last would be these conversational or chat agents. And so these are truly interacting with a person in some way, whether that's through chat, through voice, through some other method. But if you think of these as sort of app agents are a little less agentic, as we would call it, more interactive from a traditional mechanism all the way through being fully chat agent style. So what are some common features of AI agents? This is a really, really, really technical term and a technical way of saying it. So I thought I'd simplify things a little bit more. But AI agents are generally using a model. So there's something called an LLM, a large language model, and that's what allows these systems to interact using real language. So when you say, a square or shape, it's able to make those connections behind the scenes and build an understanding of what you're asking for. It does connect to different tools and libraries to get information to enhance what it's trying to understand and to execute on tasks. And then it's able to remember conversations to build additional context. And in the future, we do see this getting, the opportunity is there to solve bigger and bigger problems as these models get bigger, as we leverage multiple models. So having one model check the output of another model, or creating smaller models that are more specialized in certain things and chaining them together. So all agents are leveraging this kind of memory capability, this access of what we would call APIs or other tools, and then leveraging these language models um, to to make these decisions and to think a little bit further. I will comment, I think it's important to talk about security in the context of AI. In all IT, we always worry about security and privacy. So just some things to keep in mind. And this is true, excuse me, if you're using a tool that's embedded in a solution, or especially, and even more so, if you're using something like ChatGPT, or any of these public models, just be mindful that what you put in can technically, depending on their data policy, be leveraged for improving the model. But if you're putting patient information, confidential information about the company, those are now technically you've given up that right unless it's a private and you understand the data model there or the data rights there. Almost all models retain conversation history, which is super helpful if you want to leverage that down the road and say, remember our conversation last week about this, then it's very helpful. But again, it's just another reminder that those things can be accessed in the future. And that means that is sitting in sort of a server somewhere out there in the world. So be mindful of that. In your world, again, working with your head of technology to understand which tools are approved, and helping your staff understand that as well is important. And then one more thing is, it is possible for AI to go rogue. We call it hallucinations in the world of AI, and there's a very well-known legal case where a lawyer asked functionally the equivalent of ChatGPT to help it with its case, and ChatGPT gave it very credible case precedents that were all made up, and the case was thrown out by the judge because they weren't real cases. This is still a reality. There are times where AI in general tries to be overly helpful and can make up answers. And so I just really encourage people to verify anything you get output from an AI. Don't trust it by default. Again, it's a tool. It is not taking over for you in most of these cases. I did want to have a poll question. I want to ask people a question. And so hopefully this will come up for you guys, but I want to understand, how are you currently using AI in your health center? I'll let you read the options, but it's anything from we're not using it all to we are all in, we're building our own tools, and sort of a spectrum in between. So I'll give you guys a minute to answer that if you don't mind. All right. Hopefully you've had time to do so. So Jill mentioned earlier that we at VI did work on a study recently. Really, I think we wrapped it up end of last summer to better understand how people want to be communicated with. Jill talked a lot about meeting patients where they are, their communication styles, what they're looking for, and not have a one-size-fits-all. So in our study that if you stick around, you'll get a copy of, 75% of patients say leaving personalized videos or phone messages from their doctor enhances their trust and confidence in the relationship. And so by creating these more personalized videos, personalized messages, we're able to gain patient confidence across a broad spectrum of different types of patients. Almost 80% patients would be more likely to open, engage, or respond to messages from the health provider if they were more personalized. So feeling like it's a generic message is obviously not as ideal. And as much as 36% already expect providers to be using these tools, which seems like a huge number as constantly increasing in this world as we see more and more AI out there. This is continuing to increase. So people are already expecting us to be using it. And based on what I saw, not that much of the population is already using these tools. So there's a little bit of a mismatch there for us. So we'll talk a little bit about how we're leveraging AI and how we think you can leverage AI to move this forward. So one key area is no-show and cancellation reduction. So this is a big area of focus. I talk to a lot of health providers groups that are focused on how do we reduce no-shows. Something that really stuck out for me that Jill talked about was addressing patient anxiety, fear, and emotional vulnerabilities. And I think this is a really good one. Being able to use educational videos in pre-appointments, messaging that we can proactively address some of these concerns, especially if we can do that in the voice of the provider they're going to see and trust, can really reduce some of those concerns. Being mindful, communicating to them in the right way. Also identifying patients for visits. So a lot of times people fall through the gaps, and we'll talk a lot about that, but having technology identify which patients have fallen through the gaps, need to be re-engaged. Either they cancel an appointment and never rescheduled, or they have a gap in care. How can we support them through that? I think is important. And then there's administrative tasks that we can automate, taking burden off of staff, taking things that are easily repeatable and automated, and using the tools available to us. So this is an actual text message that one of our team members received recently, I think last week, to remind them to show up for their appointment. So I would say this is the least personalized message I can think of, except for maybe if it said, and it actually had brackets with your name in here, which I receive in marketing emails all the time. The reality is we really believe that one message for everyone really doesn't work for anyone. This is just a really unfortunate presentation. It does send a reminder, it does achieve something, but there's so much more we can do than this. And so as we look at this example a little bit more, you can see we actually can leverage a lot of information we have about the patient. We understand what their preferred language is. We can do some analysis of how they've shown up in the past. Are they of a category that's more likely to no-show or less likely? Are they someone who should be notified the day of, the day before, 3 days before? Do they want to be, is this someone who's a mother that they can if you communicate to them during the day, they're far more likely to take action, where someone who works 9 to 5 may be more likely after 5 o'clock. And so we can even specialize around, really take any of the messaging that we might be able to use and leverage and translate into just about any language nowadays. It's no longer, record in Spanish and English, and that should cover most people. We can cover almost anything with the technology we have available to us. So this level of personalization that I feel like Jill really alluded to is accessible and available without adding additional burden, and really beyond what most of our staff are capable of today. So just using one example, we have one of our partner FQHCs, after joining us in 2023, I think, it may be 24, I can't remember now, but year over year, we were able to see a 20% improvement in no-show rates. So we think there is much more to do here, but just by using some of these pre-appointment and no-show solutions, we were able to show a pretty drastic decrease in no-shows that have had a really positive outcome for them. They were using mostly generic reminders like you saw earlier, using really no pre-appointment education, and we were able to enhance that in a pretty drastic way. And again, I think we have a lot more we can do and help them with and are working through now with them. So as you think about AI from a full spectrum and how we're looking at it today at Vital Interaction, but I really think how this applies to anybody. There's a lot of patients that are slipping through the cracks like we talked about. FQHCs in particular serve vulnerable populations. A lot of those patients have barriers to care, as you guys know, dealing with transportation issues, work schedules, often financial constraints. Many patients aren't proactively scheduling wellness visits or cancer screenings or follow-ups, which is creating gaps in care. Our staff is stretched already, which makes it hard. Again, I know a lot. I spoke to a team a few weeks ago on the Gulf who said, their teams are getting to calls when they can between doing other work. And that just leaves a huge gap of opportunity. So AIs allows us to bring data in from different systems and take advantage of as much data as possible. It allows us to create and identify patients needing care and follow-up. We create campaigns that are focused on where they are in their kind of journey through the health system. We're leveraging AI now to create videos and audio voice that is in the voice of their providers. And we'll talk about that here in a second, but that's allowing us to engage with providers for a short period of time without overburdening them to get this great result. Being able to take all of this, I guess, just to summarize, to take all of this to get to the right patient, to personalize the message, and then tie that to an action on the other side as well, whether that's scheduling, engaging them back into the clinic where you now have someone who is able to pick up the phone and have a conversation and have that personalized interaction. It's important that we're driving all the way from the data through action by the patient. So I'm going to try this. Hopefully you guys are able to see this video and hear it. We'll give it a shot.
Hi, this is Dr. Agarwal from Healthy Ways Medical. I hope you're doing well. I wanted to reach out because I noticed it's been a while since we've had you in for your annual wellness visit, and I want to make sure we're staying on top of your health. Your annual visit is more than just a checkup. It's a chance for us to look at the full picture of your health, catch any early issues, and talk about anything on your mind. I know life gets busy, but these visits are important, and I'm here to support you however I can.
So we're really excited about our leveraging of AI in this use case. And so we were able to take a 2-minute video that was recorded by this provider one time and apply a different script to it many times, including different languages that were able to be translated. This is saving the provider time. Obviously, provider time is hard to get. It's hard to get them nailed down to record a video. And then oftentimes right after that video is recorded, it's already out of date and we have to come up with something new. And so this allows us to take advantage of that one-on-one relationship between the provider and the patient. But we can create lots of different videos for both, primarily for us pre-appointment as well as post-appointment messaging. We've worked pretty hard to make sure this is secure, and that's obviously something we need to be mindful of. And also we have a very strict approval process for how we apply these scripts and translate them into what becomes the video, so that the video going in is the provider, the video coming out is still the provider, even if they didn't record it, they've approved it, they agree with it, and they're all 100% on board. We have also seen provider videos resulting in over 300% improvement in response rates in many cases for a lot of our messages. So this is a really great way to take different levels of AI technology and layering them to have a huge impact.
Hi, this is Dr. Agarwal from Healthy Ways Medical.
There we go. So we talked about a couple of different ways. Another way that we can leverage AI is through administrative tasks. So using AI in the call center to, using chatbots, using voice for repetitive tasks, for easy to answer questions like, when is my next appointment? What are the hours? And then handing it off if appropriate, if it can't handle it. Using intelligent scheduling to manage provider availability, reschedules, and then documentation. Jill talked about scribes, as well as reporting to ease staff workload. And then where's this going? So I think there's going to continue to be increased collaboration between teams. Right now, we're really automating tasks within a team, focusing on one role at a time. AI is going to allow things to pass between teams much better. I'm super excited about what we're able to do in personalization with patient engagement strategies. A lot of that is going to come down to what we can get from the patient and put into our systems as well. And so what will change, I think, a little bit here is right now, there may not be a lot that's used when someone says their native language is Portuguese, because there's no capability to do that in the system today. In the future, that's going to be critical. Education level might be really important in the future, so we can figure out how to tailor a message to someone that never graduated high school compared to someone who's got an advanced degree. So we're going to see more and more personalization in engaging patients, and then better predictive capabilities. So there are some pretty amazing tools out there. We're partnered with some to look at population health and better patient care management by looking at what's coming down the road based on early signs, as opposed to what we're already reacting to. So just want to cover some key takeaways. AI is not about replacing humans, but really enhancing the capabilities of the teams that we have, making them able to do more. And I really like to think of putting our care team in the position to do more, spend more time taking care of patients. Solutions can help FQHCs increase efficiency, reduce no-shows, and improve patient engagement. These are things that we can do today. These are not futuristic capabilities. There are a lot of clinics and providers that are doing this today. And things are changing pretty quickly. I've read some statistics that as many as 25% of repetitive tasks can be automated today with AI. That's expected to be above 50% in the next 18 months. So it's going to only go faster and increase. This is not something that's going to go away. And so taking advantage of it now, especially for health centers and community health centers, is going to be important to set up for the future. So I know we still have a Q&A section, but just in case someone has to leave, because I was a little on the long-winded side, I wanted to make sure we splash up our free gifts. If you don't know, hopefully you do, but this is where you would pull out your phone and scan these QR codes. Jill's patient journey map on the right. There's a great workbook there, and then the study that Vital Interaction was able to do, looking at the generational aspect of patient communication and patient engagement.
We have a question. What use case do you apply the voice message for? I have an idea about that, but you want to go ahead?
What use case do you apply a voice message for? Lots of use cases. So we will communicate to patients primarily in 3 ways. So we'll use text, email, and voice. So oftentimes we'll use text and email. We'll include a video where appropriate. In many cases, we will actually use voice messages to call out to patients. There's still a pretty large percentage of patients that prefer to be communicated using voice, and we'll do that with AI and with dynamic messages, as well as delivering voice messages themselves. So it can be pretty broad. We try to reach, I think we've seen statistics that say you need 3 to 5 times communicating to a patient in order for them to take action. And one of those, very useful, one of those should be at least voice.
Yeah, more personalized. Also better for people who have reading, challenges with reading or their vision. Can you go back to the screen with the QR codes? I think we could just leave it on that screen while we answer questions. Does anyone else have a question? Does the AI tech actually place the appointment in the electronic health record?
So there are tools that that definitely can. I mean, creating schedules is pretty straightforward, but it's going to depend on the technology that you use for that and their integration with your specific PM system. A lot of times the practice management system becomes the lowest common denominator there, but I've seen systems coming along pretty quickly as well. So I do think that's very capable.
You know, I wanted to elaborate a little bit more on cultural training. You might be asking, like, what does that even mean? A lot of cultures have different ways of communicating and different ways that they want you to communicate with them. For example, you know, it might be that the culture in their culture, the women don't like eye contact. We have served a patient population that had this, and so we trained our staff that because we as Americans, we want to make eye contact. We think that's important in patient care, and I think it is. But if it's not how they want to be communicated with, we need to understand that about their culture. Other cultural competencies might be, you know, migrant farm workers. If they are Hispanic, a lot of them like to bring family members. And sometimes we want to say, oh, it's just the patient or just the patient and one other person. But in their culture, they like to bring several family members. So being aware of those cultural differences or norms for them and making sure that your staff understands how to serve them with those cultural norms.
Awesome. I did see one question around, you know, can you use an iPhone for recording a video? And absolutely. I mean, happy to help anyone who wants to reach out. We'll after this, we'll put up our contact information as well. Happy to help people understand the best ways to create videos. You know, using an iPhone, it's an amazing camera. Some of the Android phones, lighting is probably the biggest issue I see, is just making sure we get lighting right. Jill's got some great lighting right now. But lighting is important. But yes, you could absolutely use an iPhone, and the tooling that we've created and are leveraging will allow someone to make a 2-minute video reading a script that can be used in many use cases over and over again, which we're seeing a lot of success with. Jill, I saw another question around, do you have any ideas for really quick wins for creating a more patient-centric communication?
Yeah, I mean, I think that, like I said, it starts before the appointment even happens. So being able to know who's visited your website, who has started that, you know, appointment scheduling process, maybe didn't follow through with it, you can definitely send them a message. You should be able to see who's visiting your website. And with a chat bot, you could say, hey, I see you're on, we've all experienced this, right? I see you're trying to schedule an appointment. Can I assist you with this? So really trying to provide that patient-centered care right from the beginning. And then like I was talking about, sharing the forms ahead of time, letting them know what to expect from their appointment ahead of time. When they get there, they should be greeted with a warm, friendly staff person or a kiosk. They can definitely check in and have a personalized experience with a kiosk, but making sure people are talking to them, making sure they're reading their body language, understanding if they're coming there with some emotional distress, some worries, anxieties, and addressing those right from the beginning. it looks like you might be nervous. Don't be nervous. We have a great team that's going to serve you today. Is there something in particular that you're worried about? How can we address those feelings you're having right now? So I think just from the very beginning to after the appointment, making sure that the entire staff understands how best to serve a patient.
Awesome. It looks like someone had asked sort of favorite AI model or app, tool. I'll be honest, I am great at starting things. I haven't historically always been great at finishing things in my career, especially documents, procedures, some of those things that to me getting to the end of seems like a really burdensome task. I do use ChatGPT pretty heavily to help with that, to say, here's the context of what I'm trying to build, here's my audience, and here's who I am. And then I'll either do it with my voice or I'll type a ridiculous amount of mind thoughts into that and ask it to clean it up for me. And that will get me from sort of the first 20% of thought process around it to about 80, 90%. And then I can spend another 10, 15% of my time just cleaning it up. And it does really reduce the amount of time I spend on that stuff. I would say I have written more documents or produced more documents in the last 18 months than I have the last 7 or 8 years of my career. And they've been helpful. There are lots of people who like those documents and lots of people who like to create that stuff. And so finding ways that it allows me to create in what people need to receive, not just how I like to create it. So ChatGPT is pretty high up there for me. There's some other visual creation tools that I am a fan of. They just make video, internal communication a little more fun when you can create a custom graphic as a background, as opposed to just putting text on the screen. We have more professional people better than me at doing that for this presentation, but in general, I do enjoy some of that because I can spend 5 minutes coming up with something. So not necessarily related to this topic, but those are some things I enjoy working with right now. I'm going to progress. Hopefully everyone got that if they needed. I'm also going to put our contact information up here. So I know Jill's a really valuable resource to anyone trying to make this transformation. I know she's got a lot of great tools. And then anyone looking to leverage some of this technology, or even if it's someone who just has additional questions, you guys can use this code or the information we send out afterwards. And I'm happy to reach out to anyone afterwards and connect as well. Talk about your technology strategy, talk about which tools you're using, and help out in any way we can. Jill, anything else to kind of wrap up with?
I don't think so. Thank you so much, everyone. Get a hold of me if you have further questions. I'm happy to discuss or talk to you and answer more questions if you have them. We are going to send out a survey to let us know if you found this webinar to be valuable, and a recording of the webinar. So stay tuned for that.
Awesome. Thanks, guys.
Thank you, everyone.